Hi, Alina, can you hear me?
I can. Can you hear me?
Yes. Good morning. I know it's
Good morning.
earlier over there for you.
It's okay. It's just 8 o'clock here. So
Nice and early. Well, good morning to everyone. We are on Facebook Live today. Welcome to all of you that are joining us. Please share, like on your Facebook as we are going to have an interesting conversation this morning. For those of you I have not had a chance to meet yet, my name is Patricia Mota, and I am currently serving as President and CEO for the Hispanic Alliance for Career Enhancement. We are a national nonprofit that is working to provide access, insights, and professional development to both aspiring and current Latino professionals across the country. And this is our series of Cafecito con HACE that we began as one of our virtual programmings to be able to provide resources and information to our audience in a virtual manner. So please grab your cup of coffee, your cafecito, and we'll get started here shortly. And really quickly, this is also brought to you by Cafe Ama. So this is, for those of you who've been following us, this is a cafecito that is created by one of our Mujeres de HACE alumna, Angelique Sina, that is supporting women and children entrepreneurs in the island of Puerto Rico. And so please support. They have a special for Mother's Day going on right now. So if you got your free bag because of your last couple of engagements, make sure to pay it forward and get your own on their website, cafeama.com. And so today I'm happy to have Alina Moran, someone that I personally admire and had a chance to meet as a college student through the Hermandad, the sorority of Sigma Lambda Upsilon, Señoritas Latinas Unidas sorority. One of the first professionals that I got to meet and really look up to and really help drive my own career aspirations. Alina, thank you for joining us today. You're a healthcare executive, and can you share a little bit more about your background and your own career trajectory? But before we get started, let me not forget, ¿cómo te gusta tu cafecito?
mi cafecito. I like it basically black with just a spot of cream. So that's how I like it.
Nice. I like it's very interesting to hear how everybody likes their cafe. So, okay, tell us about yourself.
Sure. So I've been in healthcare over 20 years. I began through an organization. I got my master's through the National Urban Fellows Program. And as part of that program, you do a 9-month internship. And I was lucky enough to do it at Bellevue Hospital, which is part of the NYC Health and Hospital system. And that's really where my career in healthcare began. My undergraduate degree was in mechanical engineering. And then I got a master's in public administration and wanted to do something related to healthcare. I feel really, when my parents migrated here from Puerto Rico, they did not have access to insurance and kind of needed a support mechanism. And so even as a young child, I realized that there's a lot of opportunities for us to do advocacy work around healthcare disparities. And what does that mean, both for me personally, but also professionally. So every day in terms of my career, which, I've gone through the organization at NYC Health and Hospitals. Now I'm at a new organization, Dignity Health, the president at California Hospital Medical Center. Both organizations have really similar missions. They really want to advocate for their patients. They're safety net organizations that are really focusing on healthcare disparities and focusing on those things that we need to do to make sure that healthcare becomes a human right for most Americans in the United States.
Wonderful. And thank you for sharing your story. ASE, we like to shine a light on a Hispanic star such as yourself, because we have many of those aspiring, whether they're young women and men that want to get into healthcare, especially now, right? You see the current situation that we're in with COVID-19 and the need not only for additional healthcare workers, but just the sense of so much giving and how can we support our current frontline healthcare workers. And then it's also Nurses Week, right?
It is.
What can we do in our homes to ensure that we're sending our gratitude and our thanks for all of those workers in the hospitals?
Well, that's a great question. I think what we've been receiving so far are great ways that individuals as well as organizations can help. So we have been just inundated with a great response of individuals providing us with donations, right? Whether that's donations related to equipment, masks, but even food donations. So a lot of the staff have been really enjoying the support from local businesses here in California that have been providing us with breakfast, lunch, dinner, snacks, flowers. So all that is great. I think it's, from a morale perspective for the employees and for the staff members here that are working so hard each and every day with their patients, the generosity that has been experienced by the community is wonderful. So I would just say continuing those donations are great. The second thing is really around advocacy. A lot of the hospitals, especially healthcare systems like California, where we're a safety net institution, funding is always an issue, right? So advocacy with your local representatives, with other businesses, even with the federal government around allocation of resources are important. Third, most organizations typically have some type of, fund or we have a foundation here called the California Hospital Medical Center Foundation. And we're always expecting donations, whether those are, donations that we've been receiving in terms of food donations or just general monetary donations are a great way to support. And then lastly, I would just say, making sure that you're staying at home and really practicing that social distance. One of the things that we've seen here in California that has really helped us in terms of learning from what our colleagues experienced in New York is really putting a stay-at-home order very quickly in place that has helped us really to try to, not necessarily reduce the number of cases, but actually plateau that number and kind of reduce the trajectory that we were seeing in the beginning, weeks in March.
Yeah, no, those are all great ways to support. Yesterday, right, we just had a Giving Tuesday as well, but of course, nonprofits and the hospitals, right, are still in need of financial support. So thank you for all of those that expressed generosity yesterday on Giving Tuesday, but continue to give today and moving forward as there's such a need as well. And, you talked a little bit about, the healthcare system and how are some ways that we can pay it forward. Those of you out there, please, because I need to keep in mind we have those on Facebook Live, really watching this from all over. If you will, on the comment sections or as you're sharing, if there's any specific ways that you're giving back or suggestions that we can give back, please include them in the comment section. We want to hear from you as well. And so, Alina, we're thankful for all of the frontline workers. And can you share more about any personal experience? We've been hearing a lot about the PPE or the lack of personal protection. What was the
equipment?
I was like, I forgot that one. The personal protection equipment. And how do you envision, that experience and just the general experience that healthcare workers, the healthcare system has experienced? What do you envision happening in the future as a result of all of this?
Yeah, I think one of the great things with the healthcare system, and especially being part of a larger system, is that we have the ability to share resources among our hospitals, right? So I know that a lot of the discussions that have been happening in New York and in other parts of the country related to the lack of PPE, I necessarily haven't experienced here at California, partly because we are part of a larger system. And so anytime that there was some need, and of course, we're tracking this on an hourly basis. Right. We were able to reach out to either our sister facilities or reach out to our corporate office and kind of get the resources that we needed. We've been following kind of the CDC guidelines. And so those guidelines really help us to better understand as we learn more about COVID-19, to better understand ways to protect our staff and our patients. And so we've been learning from those experiences and kind of being able to meet the guidelines. As we think about kind of what the future is going to be with COVID-19, I think we're thinking about ways where we just need to have kind of the foundation in place to be able to support an ongoing level of patients that will be coming in either COVID-19 or potentially what we're considering a person under investigation, which is someone that likely, but we would need to test. So I think from our perspective, we're going to be looking at kind of universal testing at some point. So what does that mean? That means being able to quickly assess whether a person is positive or negative, right? And so right now, in the beginning, we had a significant delay in terms of testing, in terms of getting those results back. That has been improving week by week, but we really need to get to a point where we have some type of rapid testing in place where we're able to determine that very quickly. I think the second piece is that we're going to probably see an ongoing need for some type of face coverage, right? Whether that's just a cloth mask or surgical mask. Because of the way the disease progresses, that's something that's going to be important. And so we're always going to be kind of monitoring our usage of personal protective equipment or PPE, and probably having to spend more in that regard because of the way that we need to isolate patients that have COVID-19. And I think the last piece is that there's probably going to need to be some advocacy in terms of the reimbursement related to treating patients with COVID-19, right? Right now, we know that we have a significant number of expenses that have gone up related to treating our patients. They're in the hospital longer, their acuity is higher. We know that from a supply perspective, we're using more personal protective equipment to protect both our staff and our patients. So all those things I think are going to factor into things that we need to think about as we continue with this, with COVID-19 and the impact that that's going to have. So I think those are the things that we're thinking about right now.
Lots to think about for sure. Thank you, Alina. For those of you listening, I've been hearing as well, folks that perhaps are looking for, PPE protection or face masks. If you have any resources that you found in your local communities, please post them on the comments section, and also start sending your questions in for Alina as we have a few minutes before we will wrap up. So like, comment, share. Alina, anything else you would like to share before we open it up to questions and specifically, regarding maybe perhaps your career trajectory, anything or on the COVID that we just mentioned?
Yeah, I mean, I think one of the things, and you kind of alluded to this, is that it is Nurses Week. And so I wanted to take the opportunity to thank nurses across the US for their valiant efforts. I mean, I've always known the importance of kind of what nurses mean, especially to patients that are hospitalized, from both personal experience and some professional experiences. But I think during this period of time, when you see the efforts that they have to go through in terms of the PPE that they have to wear, the long hours that they're serving, it just gives me gratitude to know that we have such a dedicated team here at California Hospital Medical Center and within our system. And so I want to acknowledge them and thank them for the work that they do each and every day. I mean, they are really our strongest advocates in terms of providing direct patient care. And sometimes, they go through an emotional toll in terms of being able to treat their patients and have to be very stoic in that regard. And so the ability to thank them, I think, is important. So I just wanted to do that, not only today, but every day, but especially because it's Nurses Week.
Yes.
And I think the next thing that I would say is, personally, starting any new job. So I've been here for about 2 months now. And
so you went from the East Coast to the West.
Right. Yep. So I was in New York. Now I'm in California. And when I first arrived here, really that was just the beginning of kind of what we were experiencing in terms of COVID-19. And it's just quickly, escalated in terms of both the number of patients that we're seeing, as well as the things that we need to do to prepare here at the hospital. So that's just been, a really both a personal journey and a professional journey to me, right? A lot of the things that I thought that I would be doing within this 60 days are vastly different than what has happened. It's really been, a team effort, and we've been kind of meeting, on a daily basis to really be as prepared as we can be. And I've been in constant communications with my colleagues in New York. They've gone through a significant brunt in terms of both patients and surge, especially the system that I was with prior to coming to Dignity Health. And so that has kind of really helped to ease my mind in terms of the things that we can be doing and learning from their experiences in terms of what we can do here in California.
courageous, Alina, to pick up and leave from one coast to another. Not only that, for, you know, to take a new career, a new role, but also uprooting your family. And so that speaks volumes in terms of the support system that you have, but also the leadership traits that you have. We have a question here by Roseanne Santos. I wonder if this is one of our hermanas. I think it is. As someone who is running a hospital in a large market and has run one in New York, from a career perspective, what are the skills that the best staff people have in a time like right now?
Well, I think one of the things that I always advocate is being a change agent, right? And so, and being able to be nimble and flexible. So I think those are the two things that I would highlight, is that, you know, some people like me, like change and like to kind of be involved in those efforts. And so being able to lead an organization with that type of mindset, I think is important. I think it gives people the opportunity to realize that you learn from your mistakes and that not everything is going to be perfect, but that you need to make sure that you're doing your best for both your patients and your staff. And then the other piece is really related around just being able to be vulnerable to certain experiences, right? I mean, we've had really tough days here at the hospital, and I think those days make us stronger. And so sometimes you have to kind of share those personal experiences with the staff and really be able to highlight the work that they're doing on an everyday basis, because it's not going to be perfect, but it's something that we want to highlight and make sure people feel comfortable in that vulnerability of kind of the situation that's going on here at the hospital.
Yeah, I mean, and I think across the board, right? Adaptability and flexibility. If we don't haven't figured that out by now, right? I think it's something we will need to figure out soon. We have a question from Veronica Rodriguez. People diagnosed with COVID-19 that don't have health insurance for whatever reason, will they be treated in the hospitals?
Yeah, so most hospitals have some type of charity care kind of program in which patients that are either undocumented or uninsured are able to receive services. We're a safety net hospital here at California Hospital Medical Center. So we do have patients that don't have insurance, that are undocumented, and they will receive services here at this hospital.
Wonderful. And one last question, Alina. And for those of you, if we don't get to your questions, we'll try to respond to them at a later time. But we are running out of time. So I think this is a good one. It's at the end of this pandemic, as a healthcare professional, what are some of the positives you think we'll be able to take away from this?
Well, I think a few of the positives will be really how we were able to adapt as a system. I think that in healthcare, we're used to being able to look at a particular, disease burden and kind of think about ways to be creative and share best practices. So I think that's something that we can continue to aspire and learn on. I think that the level of collaboration that we've seen across healthcare systems, even, like being new to this market, I've just experienced an overwhelming support from some of what we would consider our competitors, right? Other healthcare systems and other hospitals that we really are trying to get together and understand how can we support each other from both an equipment perspective, from a patient perspective, and really sharing those experiences. And I'm hoping that that will continue post-COVID, because I think it's an important piece, especially as we think about population health and thinking about the disease burden in the community. Ways that we can collaborate as a healthcare system are ways that we're going to be able to do better for our patients and for our communities if we're able to kind of continue to share those best practices and continue to be supportive of each other. I think the key piece that I started the conversation with around healthcare disparities is something that we really need to better understand. I think COVID-19 has really, once again, brought to light the level of healthcare disparities that we have across this country, and things that we need to do a better job in terms of working with local community-based organizations, working with local advocacy groups around making sure that we're addressing kind of those social determinants of health that are really impacting people's of color's ability to receive the services that they need.
Yeah, and guys, there's been a flurry of now either articles, resources, information that's talking about the impact on our Black and Brown communities. And so if you guys have run across anything, please post it on the comment section. We'd like to get those resources out there, information out there, because I think that that's really been shedding a light on that. And then on the positive note, I do hope that the generosity, the kindness that really has come about continues after. And so I am hopeful that that will continue to be the case. Alina, thank you not only for your time, but for those of you that don't know, Alina is also one of our advisory council members who I get to pick her brain every now and then. So thank you for your kindness, your generosity, and taking the time during such a busy time in your life. So thank you to everyone, and have a good rest of the day. Bye-bye.
Thank you. Take care. Bye.
Bye.